Hi, I'm Dr. Janet Pope reporting at Room Now. I hope you're enjoying the ACR 2020, our virtual Congress. I can tell you I'm learning a lot. This is an abstract, and the results are kind of solemn to me. So it's abstract number 1462. And what this was a large survey of men who would have exposure as coal miners or other silica exposure. And the question was, do they have inflammatory arthritis? And then validating by things like they're on disease modifying drugs. Do they have a diagnosis of RA? So the first thing to note is that Kaplan syndrome still exists. And for the keeners, you probably already know historically that Kaplan syndrome were people working in the coal mine, obviously men back then, who developed rheumatoid nodules and often had rheumatoid arthritis. And the solemn findings here are that we are still finding rheumatoid arthritis and with a pretty high relative risk in people who are coal miners or other exposure to silica. Number one, why aren't we protecting our workers better? And number two, this dust exposure can affect the patients. And although they didn't look in the abstract, I'm sure it could have secondhand consequences to the family members or people that live in the towns or the cities where coal mining is a big deal. So I think the way that I will change my practice is I'll ask patients about exposures and a work history, and obviously to try to advocate for my patients for good safety. I hope you're enjoying ACR and follow us at Room Now. Thank you.